Welcome, everyone. Thank you so much for being here for our presentation on opioids and fentanyl in our community, parent information night for parents and families. We have quite a few people here that are in collaboration with us to bring this to you, and some presenters that I will introduce in a moment. But logistically, before we get started, this is in a Zoom webinar format, so it's a little different than just a Zoom meeting. So throughout the meeting, you will not have access to be able to chat with us, but you will have the opportunity to be able to use the question and answer feature. So if there's a question during the presentation, you can type it in the Q&A and it will come to us. If we are able to answer it during the presentation, we will. If it is something that we would like everybody to hear, then we're going to wait and hold questions at the end, and we'll read those out so that everybody can hear the answers to them if we think it's something that the whole community should hear. So just a little different format with that. And also we want to make sure that everybody is aware of our interpretation at the bottom. So there's a globe at the bottom. We want to make sure that you click on Spanish if you need it. We have our interpreter here. And Jimena, I'm sorry, that was a lot of information for you to go and start with before we go. You want to do that part real quick and then I'll introduce. Thanks.
Muy buenas noches. Les queremos dar la gran bienvenida a todos los que nos están acompañando el día de hoy. Sí les queremos dejar saber, sé que Mariana la deben de estar escuchando en el canal de español. Si ya escogieron el canal de español, entonces hay esa opción. Mariana es nuestra gran intérprete de la noche. Espero que esta información que vamos a compartir con ustedes en colaboración con el Departamento de Policía de Petaluma, como también el Condado de Sonoma en el área de salud, sea de su agrado. Muchas gracias por estar con nosotros esta noche. Go ahead, Gina.
Thank you. So we are going to start. We have Mr. Harris, our superintendent, who is going to do a little introduction as to why we are here. And we also have one of our assistant superintendents, Maite Iteri, who is also going to speak towards the end with a little summary. So we have both of them here. Mr. Harris, I'll hand it over to you.
Thank you very much, Gina. I appreciate it. Good evening to everyone here. Looks like we have 60. We're currently at 63. You can just see the level of 63 participants. You can see the level of interest in this topic this evening. Muy buenas noches a todos. Gracias por estar aquí con nosotros con 64 participantes. Hay mucho interés en este tópico. I know the rest of the evening will be translated thanks to Jimena. So thank you, Jimena. So I want to start just by thanking our panelists here. Thank you to Detective Boyd for being here with us this evening. Sarah Ferraro Cunningham. Thank you to Carla Denner, Donna Newman Fields, and thank you Maite Ituri for being here as well. And thank you Gina and Jimena for putting this on and getting us organized to do this. For those of you who read our bi-weekly or bi-monthly newsletter, the fentanyl opioid crisis here in Sonoma County is real, and it's impacting it's really impacting our own community. So on early September, we had a student who tragically passed away due to fentanyl. And his name was Daniel Adams, and we did a big announcement about this, and then later in the papers. On September 17th, I had the honor of attending his funeral and celebration of life, and spoke with his relatives, who were very so gracious and so kind, and really wanted us to do everything we could in our powers to get the word out and make sure that this never happened to another child in our community. Heartbreaking, to say the least. Afterwards, I spoke with his mentor, Kent Smith, a wonderful man who is here this evening with us and as a listening in tonight. And so that was really the impetus. Once that happened, shortly thereafter in early October, on October 11th, Again, I had the pleasure of meeting with, it started with a few parents who were asking questions, what can we do? How can we start by getting the word out about this? And a couple parents turned into a few parents, turned into some staff, and pulling some people together. And all of a sudden we had about 15 people coming on the call, including some of our elected officials. And this is really the first step in how do we spread the word? How do we get the word out there about this crisis? As part of that meeting, I learned quite a few things as well. And I don't want to take the thunder away from anybody, but we talked a lot about how Sonoma County in 2020, Sonoma County was second only to San Francisco for the number of opioid deaths in the state. Fentanyl has recently been found at the Petaluma Library. Not to be shocking, but this is out there. It's in our local community. It's impacting our own students, and most notably Daniel Adams. And so this evening is really about how do we spread the word, and what can we do as a community, and how do we stop this? So that's really the impetus. That's why we're here tonight. So with that, I want to just mention our collaboration with Sonoma County Department of Public Health Services. Thank you for being here. And the Penal Police Department, we really appreciate your support and you being here as well. And so with that, I'm going to turn it back over to Gina Roberts. Thank you all we're up over 70 participants now. Thank you all for being here this evening. We are also going to be recording this and putting it on our website for anyone who couldn't be here with us this evening.
Thank you, Mr. Harris. So I'd like to introduce our two speakers for tonight. We are so lucky to have them both here to discuss this topic and bring all of their knowledge to us tonight. So we have Sarah Ferraro-Cunningham, who is here, and also Detective Boyd. Sarah has worked as a psychologist and addiction medicine specialist. Dr. Cunningham co-founded Panaptic. That's who she is here as part of tonight, out of a desire to bring effective evidence-based substance use prevention programs to teens and families across our county. Dr. Cunningham's innovative work led her to being selected to join Yale University's Innovation to Impact program, a fellowship designed to support leaders in substance use prevention. She is also the mother of two children, one who is a PCS student at Mary Collins Cherry Valley. So we have our very own here. And we also have Detective Boyd. He is a police officer with the Petaluma Police Department, who has now been assigned to the investigation section as a detective, and he will be also presenting tonight as well. So without further ado, I'm going to turn it over to Sarah.
Thank you so much, Gina, and thank you everyone for this opportunity to come together and to be here. My name is Sarah Ferraro-Cunningham. I'm a proud PCS parent, and really just so grateful and glad to be here with all of you. I think as Superintendent Harris was sharing, fentanyl and opioids are an issue that are not only impacting our county, but impacting our families and the people that we care about and love. And so our hope today is really to share some information and, more importantly, some tools for how we can come together as a community to support our teens. So what I'm going to be doing is just sharing a little bit about what do we need to know as community members about opioids and fentanyl. I'm going to give some information about those substances, and then Detective Boyd is going to share some specific information about how they're impacting our county. And from there, we'll move forward to talking about what do we do with all of this? How can we support our teens more in this really difficult time? So to do so, I just wanted to share a little bit of information about what are opioids. So opioids are a class of drugs. They're derived from the poppy plant, from opium, and they can be created and prescribed to address pain specifically. So some prescription opioids are made from the plant directly. Others are synthetically produced by scientists in labs. And all opioids contain chemicals that relax the body, that relieve pain. What I would say is that opioids, are generally safe when they're taken for a short period of time and when they're taken as prescribed by a doctor. But like many medicines, they have the potential for misuse. And regular use, even when it is prescribed by a doctor, can lead to physiological dependence where the body gets so used to the substance. When misused, which means taking more than prescribed, taking someone else's prescription, or buying from someone or getting from a friend, opioid pain relievers can lead to substance use disorders, to overdose, and unfortunately to death as well. So fentanyl is a form of opioids. It's a powerful synthetic opioid. It's a prescription drug that can be made and prescribed for medicinal reasons, but it's also made and sold illegally. One thing to know about fentanyl is that it is 30 to 50 times more powerful than heroin and 50 to 100 times more potent than morphine. And so as an opioid substance, that it really does impact the body and the brain significantly. And as a result, can be quite dangerous. So fentanyl can be sold illegally as a powder. Sometimes it can be put on blotter paper or eyedroppers. Sometimes it can be put in sprays or made into pills that look like other prescription opioids. I would say that there's a big market out there for online pill shopping where you can purchase pills that you think are something else. They might have fentanyl in it. But also a lot of folks that I've supported in my work in addiction medicine have ordered pills online from pharmacies outside of this country that can contain fentanyl as well. The other thing to know about fentanyl is that some drug dealers who create other drugs like heroin, cocaine, methamphetamines, sometimes cannabis products, they may include fentanyl in it as well. And so because fentanyl is pretty inexpensive, it also creates a significant high. And so we are finding fentanyl in substances that are not only opioid pills or opioids. A lot of other drugs can be laced with fentanyl as well. I wanted to speak a little bit about how opioids and fentanyl work, how they impact the body and the brain. And so one thing to know is that opioids and fentanyl are pain relievers, but by design. And so they affect the spinal cord and the brain to reduce the perception of pain, as well as the areas of the brain that control emotion. They do so by slowing down the actions of the body. So when one takes an opioid or uses fentanyl, it slows our breathing. It slows our heartbeat. Even a single dose of an opioid can cause what we call severe respiratory depression, which is the slowing or stopping of breathing, which in some cases can unfortunately be fatal. Fentanyl as a pain reliever was developed to support folks who were undergoing surgery and treatment for cancer. And so it is a rather strong pain reliever, but it works in the same fashion. It's just often much stronger than other opioids. Opioids and fentanyl also impact the brain. And so they bind to the brain cells that are involved with our sensations of pain and with our emotions. And when one uses an opioid or fentanyl, it can create a feeling of being high that's really pleasurable. A lot of people will describe it as a euphoria. I had a patient once describe it as being wrapped in a warm blanket. What happens to the body and to the mind is that after taking opioids or fentanyl many times, the brain adapts to the drug, becomes really used to it. And what that does is it makes it hard for folks to feel pleasure from anything beside that drug. And so what we see a lot is that young people, also adults, but young people especially, when they begin taking opioids or fentanyl, there is a path where they may misuse it or take it not as prescribed to feel that pleasurable feeling or high, but soon it's required just to feel okay. And so that progression of use is something that we see happening really frequently with young folks. So I want to stop there and pass the mic to Detective Boyd, who's going to speak more specifically about how opioids and fentanyl are impacting our community.
Great. Thank you, Sarah. So good evening, everyone. Thank you, everyone, for being here tonight as we discuss this critically important issue within our community. The fentanyl crisis has certainly taken over within our community, and really we've seen its effect throughout the United States. So in Sonoma County alone, we've seen a 78% increase in drug overdose related deaths in 2020 from the 3-year average that we saw in 2017 to 2019. Of those overdoses, fentanyl has been involved in 92% of all opiate-related deaths. I'll let this slide. There you go. And I believe it counts for such a large amount. Fentanyl can be laced with so many different things, and a lot of people misunderstand the real potency of the drug. It's not like cocaine, it's not like methamphetamine, it's not like other drugs, marijuana that people may use, on a daily basis or whatever the case is. Fentanyl is something that's very potent, and even the smallest amount, when laced with these other things, could cause a inadvertent overdose. So that's probably why we see such a large number associated with overdose related deaths. If you can go to the next slide, please. Thank you. So in Petaluma, we have seen approximately 41 overdose related deaths since January 2021. Now that's accounting everyone, so all ages, not just juveniles. I say juveniles may be between 5 and 10% of the total number. An even greater percentage are people between the ages of 18 and 30. All these numbers are collected from law enforcement and fire department data. I imagine our actual calls that we go to is much higher. Just because you suffer an overdose doesn't mean you automatically die. A lot of times we can get there and offer medical care, Narcan, other things to save someone's life. It's also difficult to track because sometimes people seek self-care. Some people do have access to Narcan that they will administer themselves. So we aren't notified of the overdose. We're not there to offer services or other medical attention. I'd like to really impress on the importance of calling 911 in the event that you or someone you are with may be experiencing an overdose. Sometimes youth are very worried about calling and getting police involved or paramedics involved because they just don't want to get in trouble. But in California, we do have laws that protect the individuals who are, not just the ones suffering from the overdose or other people on scene who may have drugs on them or in the area or maybe under influence themselves. These laws protect them when they seek medical attention for the overdose. So it's very important that because of the long lasting effects of the drug, if you do experience an overdose, that you seek medical attention immediately. A lot of times we can get there faster than the fire department, depending where we are in the city. All our officers are equipped with Narcan. We are trained in first aid. So if we can get there first, and the quicker we can administer that first dose of Narcan, the quicker the effects of the drug can be reversed. And it's just super important. I'd also like to stress not to handle any suspected fentanyl that you may find, as it, like I've said, very potent, and you can inadvertently suffer an overdose by simply handling the substance. Our policies have changed over the years where we don't even test the drugs anymore, just based on too many people, too many inadvertent overdose. There was a video circulating out of another county where a deputy experienced an overdose, and he had gloves on and had the proper protective equipment, but he still ended up on the ground, and it's very, very scary. So that is all that I have. I will be answering questions later if there are any, and I think I'm going to hand it back to Sarah.
Thank you so much, Detective Boyd.
Thank you.
So we wanted to spend the majority of our time talking together about how we could come together as a community to protect our young people from the risks of opioid and fentanyl use. I just want to appreciate again how many of you are taking time out of your evening to be here today. I don't think it's easy for us, especially those who are parents or adult allies in this room, to pull away during the nighttime. And I think your care and your commitment makes a huge difference. And what I want to say is that as adults in our community, we do each have a role to play. Everyone's voice in this room matters. And I would say this because I think even one conversation about substance use with a caring adult or a peer can change the trajectory of a young person's life. And it's not only parents who can take on those conversations, it's coaches, it's friends, teachers at school. And when we take the time to have these important prevention conversations, it makes a tremendous difference. So I want to talk tonight about how can we have some of those conversations? What are some helpful strategies? And also, what are some things to look out for that would suggest that someone is struggling with their opioid, fentanyl, or other substance use? Before that, I do just want to touch on a couple of tips that are really practical, but also very important. So one way that we can prevent opioid and fentanyl misuse is by storing and disposing of medication safely. So if you have a child or teen in your home, or a young adult for that matter, it can be really helpful to keep opioids and other prescription medicines up away in a secure place, even in a lockbox. A lot of teens for the first time or adolescents will use prescription medications that they find at home or that they find at a friend's parents' closet or medicine cabinet. And so knowing what medications you have, knowing how many are there, and even better, keeping them locked up and secure is a great prevention tool. That lack of availability can make a huge difference. Another practical tip is that it's really important to make sure that teens understand that it's illegal and also not recommended to try medications that they're not prescribed or to share medicines. And so, there was a study about prescription medications for teens, and it said that 80% of teens who are prescribed a medication that could be misused have been approached at one point in time by their friends to see if they would share that medicine. So I think these conversations are really important for teens who may be prescribed medicines that have the potential for misuse, like opioids or other medications. But also, even if your teen is not prescribed any medication, I think it's really important to talk about that even if this is a friend's medicine, a friend's parent medicine, that parent's medicine, can be unsafe and dangerous to take it unless it's prescribed to them. The last thing that I would say about this is that there are online pharmacies. Prescription drugs are really not that hard to find through social media or online. And so it can be helpful to talk to your teens also about not taking medication from other people. Even if it's from your best friend's cousin, we don't really know where those substances came from. And there's a tremendous risk of them being laced with or actually a full dose of fentanyl. And so just the message of only take what is prescribed to you as prescribed is really important. In our county, there are safe medicine disposal options. And I just wanted to bring this up because if you are prescribed medicines, your teen or anyone in your family, the best prevention method is if those medicines are no longer needed, to get rid of them and to get rid of them safely. So I have included here a list of some of the locations in Petaluma, Roanoke Park, Santa Rosa, and Windsor. However, if you go to the Sonoma County Safe Medicine Disposal webpage, which is linked here and will also be sent out to you after this presentation, there are a variety of sites available. And if it's hard to get out and to get there, you can also be mailed an envelope to mail them in safely as well. And so not having these substances at home makes a world of difference. So the one method for prevention is reducing availability, reducing that risk. Another method for prevention is talking to your kids, talking to your teens, and the adolescents in your life. The research shows us that children who learn about the risks of drugs at home are less likely to try them and to use them than those who don't have conversations at home. So my philosophy as a prevention person is that it's never too early to talk with your kid. We were mentioning earlier that I'm a mom of a kinder student at Cherry Valley, and I've already had, not very deep, but I've already had some conversations with my daughter about drugs and substances. The types of conversations that are developmentally appropriate for her age are pretty basic, like drugs exist, they can change your brain, and for some people they feel good, but they can harm you over time, very basic. But as our kids, enter into adolescence, we can have more in-depth conversations. And when we take the time to do it, it makes a world of difference. I would also say that if you're an adult or family member in this room who's concerned about your teen substance use, that it's also never too late to have this conversation. Even if they are using, or you suspect that they're using opioids or fentanyl, that conversation could save their life. And so it may take a different shape. You may talk about this differently, but finding the courage to talk to your teen makes a huge difference. So I want to share some of the things that can be helpful when we talk to teens about substance use and opioids and fentanyl. So the first is to try to set the stage for a successful conversation. So what that means is finding a time where you're relatively calm and where they have a chance of being relatively calm as well. And I know as busy families, that might be like, feel like it's impossible, but these conversations don't have to be long. Could go for a walk for 15 minutes and talk about it, or find a time in between activities where you're both in the car. I had a supervisor a long time ago who said, if you want to have a tough conversation with a teenager in therapy, Sarah, walk side by side. You don't have to stare at them. You can just find a time where you're doing things together. Another thing that I think is really helpful is to try to remain as calm and grounded as we can, which is hard when this is a topic that's stressful, but it is important. And then to also be authentic. It's helpful to share the feelings that you're having. It's helpful if you don't know the answers, you can say, I don't know, let's learn together, right? But teens, they can kind of tell when we're not being truthful or not being authentic. And so if you're not sure of an answer to something, that's okay. We have some resources to share with you where you can learn more or find out more information together. Another thing that's really important for prevention conversations are the conversations we have that aren't actually about drugs or opiates or fentanyl. And one thing that can help is to share with your teen the things you appreciate about them. Share the things that you value, that you love. And when we share what we love about our kids, they're more open to when we say, I love you, but I don't love this choice that you're making. I'm worried about you. Right? I suspect something is going on, or I want to talk to you, even if it's uncomfortable, about fentanyl and opioids, right? Our teens they're a little bit more open, even if they don't admit it, when we share that we see them, that we appreciate them. And opening the conversation that way can make a big difference. Another thing that has been shown to be effective is to make sure that your teen knows the rules and the consequences for breaking those rules related to substance use. So the teenage brain adolescence and the teenage years are a really interesting time because the brain is still growing and developing. The adolescent brain fully forms around the age of 25. And so the last part of the brain that fully forms is the frontal lobe. And that part of the brain is really involved in our ability to set goals and achieve them. Also, our ability to know the consequences of our behavior. There's, when the frontal lobe is still developing, teens don't always know that if they try opioids and fentanyl, it could be dangerous. They might know in theory, but they don't really put two and two together in their own life because it's a time of exploration. And so one of the things that can be a protective factor that can help your teen is to have family rules about substance use. It is okay to say, I expect you to not use opioids, fentanyl, or any other drugs. If you abstain from them, here are the things that you can experience. You can get your driver's license, or you can still, do soccer, you can go to the movie, or do whatever it is that gets your teen excited. You can keep your phone. It might be one of those things. And here's what you can expect if I do discover that you're using. You will not be able to maintain that privilege to have your phone unless we're around. You will not be able to go out on the weekends with your friends. You will, and having those consequences in place, whatever is a fit for you, your teen, and your family, is really important. Because when teens experience minor consequences like losing phone privileges, it prevents them from experiencing big consequences, like the risks of developing a problem with their substance use. So communicating ahead of time or at the time, if you're concerned about your teen, those rules and the consequences can be very helpful. Another thing that is also really helpful is getting to know what your teen does and who they're with. I can't say enough about how important one's friend group is. And so when you as a parent, mentor, adult ally, get to know who your teen is spending time with, that can make a big difference. It's also helpful if it's an expectation that you know where they are, or that they ask you if they can go certain places, that you check up on them. You don't have to be over the top, but those are also boundaries. And they can help your teens sort of stay the course, even if people in their lives are starting to experiment with opioids, fentanyl, and other substances. Another protective factor is showing interest in and talking about with your teen their daily ups and downs. So, thinking about what was a highlight of their day, or what are some struggles. And, I say this knowing that some of you may be, hoping I could bottle up the recipe for how to get a teen to talk about these things. But I think the more that we try, the more that we have conversations about, your child's life, the more open they're going to be to the tough conversations, like about opioids, fentanyl, and other substance use. And so it is important that around the dinner table or in the car or somewhere else that you do talk about these things, because it will help your teen to be more open to you. There are some signs that can suggest that a teen is struggling with their substance use. And I wanted to share this with you today so that you could know what are some of the things to look out for if you're worried about your teen or a teen in your extended circle. I want to say that these signs by themselves aren't a guarantee that a teen is struggling with substance use, but they can signify that they need support. These signs and symptoms can also signify struggling with mental health or other things as well. But if you notice any of the changes that I'm about to mention, it may be a good idea to reach out to get more support, to check in with your teen. So one of them is a change in peer group. If you notice that your teen's friends are changing, and certainly if you notice that your teen's friends are changing perhaps to a group where you wonder what they're up to, or if they're using other, opioids, fentanyl, or other drugs, right? Sometimes an abrupt change in peer group can signify that a teen is misusing substances or struggling with their substance use. Another is if you notice their appearance changing. I just listened to a podcast on how to get your teen to shower, actually. So I know grooming, appearance, and all of that stuff is an issue for many in adolescents. But when you notice that your teen's behavior in terms of their appearance changes, not so much in style or other things, but if you just notice they're not paying attention to their appearance the way they did before, they're not caring for themselves in the same way, that can be a sign that they're really struggling with something, and that it would be helpful for them to get more support. Usually when a teen is struggling with substance use, their grades change, their academic performance changes. You may notice that their grades have gone down. You might notice that they're not going to school as regularly. So skipping classes is another one of those things. But when we notice a decline in academic performance that doesn't seem to be explained by other things, that can also signify that a teen needs more help. One thing that goes hand in hand with this is a loss of interest in other favorite activities. So if your teen historically has loved soccer or video games or horseback riding or other things that are really fun for them, and they start to say that that's boring, or they don't want to do it, or they're not as motivated to engage in those activities that they used to love, that is a sign that they may be struggling with something as well. And then another big sign is when teens begin to struggle getting in trouble with school, If they get caught, but for having substances or get in trouble with law enforcement, that is also a sign that they do need more help. The last two are deteriorating relationships with family or friends, and then missing or skipping school. So one of the things that we see when someone begins to develop a problematic relationship with substances is that they tend to pull away from the people, the activities, the things that they're close to. Most often because they're stuck in a process that of using that substance, but also sometimes there's embarrassment and shame around their struggle as well. And so you may notice that your teen isn't as connected to family, or that they're not hanging out with their younger siblings the way that they used to, or that they're not spending as much time with friends, or that they're skipping class, or going to school, but not doing the things that they used to do when they went to school. And so when you notice any of these signs, I think it can be really helpful, not only to check in with your teen, but also to find a way to get them and you some more support, because this is an opportunity to get them some help before they experience other negative consequences, either their substance use or before they struggle more in terms of their mental health. Another thing that I did want to touch on was looking at knowing the signs of overdose and also knowing what to do if you are concerned that a potential overdose is happening. So some signs of opioid and fentanyl overdose are, and if any of you recall from the beginning of the conversation, opioids and fentanyl slow the body. They help to alleviate physical and emotional pain by calming the body. But when misused, what they can do is calm the body so much that the body stops functioning and enters into respiratory distress. So some signs could be difficulty breathing or very slow breathing, severe sleepiness. So if you try to arouse someone or wake them up, they're not able to. And if you were to notice that in someone you love, I think it's best to call 911 right away. Another opportunity to address overdose is Narcan. So Narcan is something that Detective Boyd mentioned earlier, but it is a substance that can reverse an overdose experience, the effects of the drug temporarily, to help someone get to life-saving treatment. And so some forms of Narcan can be injected into the muscle, but the form that I've seen most frequently and that's more readily available, I think, in our county is a nasal spray. And what it does is it immediately blocks the effects of opioids or fentanyl on the body. And it allows someone some time so that they can get to emergency medical care. What I would say is that, and later we'll be talking about resources for Narcan, places where it may be available. If you are able to obtain Narcan, if ever you're in a situation where it's utilized, I would just want to underscore again what Detective Boyd shared, which is that Narcan by itself is not sufficient. If someone were to administer Narcan, it would also be really important to call 911, because what can happen sometimes is it can reverse the effects of the substance temporarily. But if someone doesn't get emergency care, the effects of the opioid overdose can return, and that person could overdose later. And so it is really critical to also make that emergency call. I wanted to say that I was very thoughtful coming into our conversation this evening, knowing as a community member here in Petaluma, and for our larger community of folks that have joined us from Sonoma County and all over, that many of us have been significantly impacted and have really experienced tremendous losses because of the impact of opioids and fentanyl on our lives, on our community. And I think that it's a call to all of us to come together to support teens to make healthy decisions, to have those conversations early and often so that we can really make a difference in their lives. And so we are going to open up. I see that there are some questions that have come in already, and I want to make sure that we can address them. We're also going to have some time for our leaders here at Petaluma City Schools to talk about options for support and continued learning as well. But I just did want to thank you, and also say we wanted to leave ample time for Q&A to make sure that your needs are addressed, and the questions that you have at the end of this conversation we can answer together to support you and to support our larger community. So thank you for being here. And for a bit, I will also just want to share this with you. We do have resources for continued learning and support. There's some email addresses here where you can be emailed a resource guide, as well as other opportunities for connection and support. And then Jimena will also share about some of the things happening locally here at Petaluma City Schools.
Thank you, Sarah, so much for that presentation. Also, Detective Boyd. I am going to be sharing a link right now with everyone, and it's a resource list that we worked along with Sonoma County, and we worked also on translating it. So towards the bottom of the resource list that we've created for tonight's presentation, you will also find everything in Spanish. En los recursos que hemos mandado en la parte de abajo van a poder encontrar todos los recursos también en español. Some of the things we're doing in Petaluma City Schools is definitely collaborating like we are tonight, which I am super happy of. It's some of the work of reaching out to our community-based organizations, starting that conversation, seeing common crisis in our communities, and building this village to work together and informing our community. And that's what we're doing tonight. So as one of the things Petaluma City Schools is doing, and me as the wellness coordinator, this week we also had the Wellness Week in Casa Grande. I also created a little short video for them in the areas of sleep, nutrition, and self-care, and just having that wellness and good mental health. So just providing different resources. And my main goal is to provide resources to our community and our different school sites. With that, we are also working on providing Narcans to all of our staff, and hopefully down the line, we'll be able to have that more available to our community as well. Yes, and so with that, I do want Mike to have the opportunity to say some words. Thank you so much all for joining us today. Muchas gracias.
Hi, everyone. Thank you all so much for being here. I'm continually impressed by Petaluma and the community and how many people show up for our young people. So thank you all for being here. Again, always am very impressed with this community. Some of the things that were talked about tonight that really resonated with me are relationships, and making sure that our kids have relationships and are able to have those authentic conversations. It's so important. I also wanted to touch upon the friend group, and when you start to see things change for your children, those are big red flags, and pay attention to them. Sometimes we don't want to pay attention to them because we don't want to believe that maybe something's happening, but they're really important to pay attention to. There's a saying in Spanish, dígame con quién andas y te digo quién eres. Tell me who you walk with and I'll tell you who you are. So those things are important to pay attention to, those friend groups. Anyway, again, I just want to thank you all for being here, and I want to thank Jimena and Gina for putting it together, and to our guests for speaking tonight, and to this community for showing up for our children and this community. So thank you.
Thank you, Maite. And I also wanted to mention that I didn't mention prior, Sonoma County Department of Health, they're the best contact. This is out to our community. So this presentation is for the community. So if you do want some resources, because I'm only strictly a wellness coordinator for Petaluma City Schools, but if you do have questions regarding any resources or specific areas you're looking support in, or to be connected to some kind of other agency to give you the support you're needing, please do contact Donna and Carla, and their emails are on this slide. And I've also shared the link to our presentation, so you'll be able to have all of our emails and information as well. And do feel free to share with anyone who might not have joined us tonight. The recording will be shared later once we have all the the recordings both in Spanish and English to share out with our community. But for now, those resource list is there, and I've also just shared the link to the presentation. And now, with no further ado, we can now take a look at the questions our community have for us. They're asking us, how can they access free Narcan and adequate training for use? Do any one of us would like to answer that? Maybe Detective,
Hey, man, I can, so I was just looking up right now. If you go to narcan.com, that's NARCAN.com, it actually has a pretty good amount of information on that website, including where you could obtain Narcan and I believe some videos on how to use it. Additionally, according to the website, all major pharmacy chains, just such as CVS, Walgreens, and Rite Aid, do stock Narcan. And typically, you don't need it for a doctor's prescription to get it. There may be some cost associated with it, depending on what insurance you have, or possibly even a copay. Specifics, I'm not sure, but I think that would be a really good starting point, unless anyone has any more specific locations or information on where to obtain it.
While Detective Lloyd was mentioning that, I did share the link to the website, and it does have really helpful information and videos on how to administer Narcan and where you can also find it. Anyone else want to add?
This might be one for our superintendent or assistant superintendent that are here tonight. Would really like to see the inclusion of a comprehensive substance use curriculum in all PCS schools, beginning in the upper grades and elementary schools. Effectively teaching kids about substance use requires family involvement and ongoing discussion. Therefore, it is also important that the curriculum be fully transparent and easily accessible to parents. Is this something that one of you would like to speak to in terms of?
You want to speak to it?
Sure. So thank you for that question. I've been doing a little research about what's available out there and looking into what our different schools are using and trying to determine, Jimena and I are working together to identify some options for our school community, because we don't have enough and not everyone has access to it. So we are investigating it. More will be revealed about that, but thank you for the question. It is something that is of top of mind and we are working on.
Great, thank you. Is substance use abuse discussed in the high school HI classes at all? And is it being discussed in the schools with the students at all? That might be another one for Mr. Harrison. He's nodding. Yes, Mr.
I was going to say, happy to have Maite or myself. I mean, yeah, it is something that I know Maite is looking into. So the question is, in the high schools, in the HI curriculum, is that what the question was?
Correct. Is substance use abuse discussed in the high schools HI classes at all?
I do believe that yes, I believe I'm 99% sure it is discussed in HI classes. I've been in those classes and I know it's something that they discuss and they talk about, particularly with 9th and 10th graders.
Anything you want to add, Maite?
No, thank you.
Okay.
No, not yet. I will, but not right now.
Maite is working on a just sort of an overview of this has come up recently, right? And so it's what are we systematically teaching about this from really, upper elementary grades through high school? How are we delivering the instruction? What does it look like at each of our schools, so that we're consistent and clear and that we are transparent with families about the curriculum? That's something that we inherited over the last 4 or 5 months, and we are working to make sure that there's some transparency and that we're clear on what is being taught.
Yeah, thank you, Matthew. Yeah, I don't want to speak out of turn and then have it not be accurate. So I appreciate that, Matthew. We are working on trying to determine what is happening and how to best move forward from this point, so we are consistent and transparent.
Thank you both. Do we have any metrics regarding these risks, both leading and lagging, that we can share? I'm assuming that's meaning the risks of opioids and fentanyl. Somebody wants to add to that question? Do we have any metrics regarding these risks? don't know if anybody wants to answer that one.
You know, Bill, I'm happy to speak to, I'm not sure, I apologize that I'm not sure what the leading and lagging, if I'm going to be able to answer that sufficiently, but what I would say is that statistically, opioids and fentanyl are highly, substances that when misused have a high potential for someone developing a substance use disorder or addiction. I can say, in terms of the research, what Detective Boyd was sharing earlier, I think that we are seeing higher rates in our county and across our nation of substance use disorders related to opioids and fentanyl, and certainly, unfortunately, also losses due to overdose to fentanyl specifically. One thing I would say is that when we're thinking of substance use prevention, I do think, though our topic is specifically opioids and fentanyl this evening, I do think when we're thinking of these prevention conversations, it is also important to have them earlier, even if it's not about opioids and fentanyl. For example, for teens who are using cannabis regularly, they're 3 times more likely to struggle with a substance use disorder to opioids and fentanyl than their peers who are not. And so that doesn't address your specific question, Bill, unfortunately, but I do think that what we're seeing are rising rates of substance use disorders to opioids and fentanyl. And so, with that and the increased overdose rates, we all just have to pull together as much as we can. And if you would like to email me, Donna, Carla, or Jimena, I can try to pull out some research studies if I understand the question better. Thank you.
I just want to say in Spanish very quickly. Si tienen alguna pregunta en español, por favor también pónganle por el chat. Yo la puedo traducir para que podamos tener también participación de nuestra comunidad latina en las preguntas si llegan a tener una pregunta. There's this other question. What recovery programs and addiction support groups are available for our teens in Sonoma County? Donna or Carla, would you like to answer that question?
On the resource list, there are some resources listed there. Some programs like DAC and SOS Counseling that actually have programs that are directed at youth. There's also a phone number there on the resource list, 565-7450, which will bring you to our substance use disorder section at the county, and we can answer those questions more specifically based on the need that's there. I'm sure somebody's asking because they have some specific issue that they'd like an answer to. It's really hard to generalize right now, so I think we can get you more specific information if you just contact us.
Thank you, Donna. Someone has, in response to the previous question and regarding to the HI classes, they're wondering if they're elective. If they are, then how are the other students getting this important information? Maite, Matthew?
I think that most students take HI or Success 101. I'd have to get more information on that one and get back to you. What percentage of the students, do not take HI?
Thank you, Matthew.
Will the DARE program come back into the elementary schools? Are there specific drug awareness programs currently being taught in our middle schools?
Again, that goes back to our research and what we're trying to determine what is taking place and having that consistency among our grade levels. So there's a through line from kindergarten to 12th grade. So I think it may be happening in some areas, but it's not consistent. And that's one of our tasks, is to make sure that it is.
Great. Thank you. If a student wanted to escape addiction or help a friend change his or her life, are there any locally available hotlines they can call for help?
There are several hotlines that there are available, and I think, and it's again in the resource list that we provided in that link. If you take a look at our resource list that we arranged together specifically for tonight's presentation. You'll be able to find several phone numbers and support groups that are available in our community.
Somebody else responded to the HI who works for our district, one of our guidance counselors, that it is discussed in HI classes. Often community members and county affiliates are brought in to discuss in high school HI classes. Most school sites also do something in acknowledgement of Red Ribbon Week. We also had a group of educators who were getting trained on a potential curriculum pre-COVID. So we'll see to try to continue that as well. Thank you for that, Nikki.
Thank you for adding that. Was that Nikki? Yeah.
Yeah.
Thank you, Nikki. That's exactly, we were really looking at it before pre-COVID, and here we are. So we are now trying to see what is that through line as Maite discussed, K-12.
Would you be able to ask all the participants in this presentation to write in the Q&A what part of the county or outside the county they reside? It would be helpful in knowing the effective county has been in promoting this program and reporting to the funders that sponsor the county programming. We could write it. All of the panelists can answer in that if you want to be able to write what county you're in. And then back to our very first question, that was about Narcan, and you gave that list, Detective Boyd, or that website. Is there anywhere free that distributes it? Because in the county that this person resides, it's distributed free. Do we know if there's any that are free, or we're not unsure as to that piece?
I will say that the county is really busy creating a list of where Narcan can be found, is available. We do know that through the Substance Use Navigator program, the Bridge to Bridge program that's available through Providence Hospital, so Memorial Hospital, it evidently is available free there. They're trying to bring that same program, that same offer of free Narcan to the emergency rooms at Petaluma Valley Hospital. I'm not sure that that's happened yet. So there is an effort. We're also working, we're really trying to work with pharmacies around the county to try to make sure that all pharmacies or those that want to participate have Narcan available. So more to come on that. I realize that people really want to know now. They want to be able to have access to it. I know that Jimena, you're working on, you mentioned earlier, getting it available, having it available for the schools. That would be for the school personnel. We're really trying to, there's a group called Face to Face in Sonoma County that's also on your resource list that is a possible option for Narcan as well. So check the resource list out and keep in touch with us because at the county, because we're really trying to work on locating, identifying locations where Narcan is available to you.
Thank you for that, Donna. And this is also maybe Donna or Detective Boyd, a question. Is there maybe we can put this into the chat, a hotline phone number here for students or adults that they can call if they need help in an emergency situation, and 911, but is there a hotline for in like an agency if they're looking for help?
We have a few different resources. We have a mobile support team, which is MST. They serve throughout the county. They have social workers and other people on there that could offer assistance. We also have our SAFE team, which is new to Petaluma. They've done really well throughout our city in handling all sorts of different types of calls, mental health related, drug related, that type of thing, offering services. So, I mean, starting with us, and I know it's sometimes scary to talk to an officer, but we have the ability to connect people with the appropriate resources. And I definitely would encourage people that if you're having some sort of, even a drug addiction or other type of issue, please call us so we can point you in the right direction and get you connected with the right people that can help you. I don't have any specific numbers offhand. I'm sure there are some there. We have our city website from the police department has different links on there, and some of the resources that we talked about and distributed tonight definitely would be a good starting point for that.
Sonoma County Mental Health does have a mental health crisis line, and I can put that number in the chat. It is on the resource list, but I'll put that in the chat.
Thank you, Carla. And I also shared the Safe Team direct phone line for that's there also for any emergencies. You can also call 911 and they'll evaluate it if it's the Safe Team, the most appropriate to come out. But I've also included their direct line for the Safe Team.
Jimena, do you want to read the one that? Thank you.
Yes. Thank you. For example, sometimes our youth have meetings and they can have a scene of an overdose. Would the youth be charged with criminal or when they call 911? I see a lot of youth have fear of calling 911. Detective Boyd, if you like to reinforce what you mentioned in the presentation earlier, that would be great.
Absolutely. So were you going to translate that for me to her? Or is that already being done?
Right. So they're saying that the youth are, you get together in a gathering and there might be a scene of an overdose and they're afraid to call 911 because of being criminalized.
Right. So yeah, anytime anyone who's experiencing overdose or they are around people who are experiencing overdose, if you call for medical assistance by either calling 911, calling the police department, there will be no criminal charges filed. What we typically do is our main objective is to get to the individual and offer them medical care, which would be Narcan. We collect, if there are drugs located, we would collect them and we do book them for destruction. So they're no longer out there. But we do not seek any criminal charges against any of the people or persons involved in the situation. It's a huge thing with the new laws with that, given it happens so often and some people still don't know and are unaware of that or just afraid of calling. But like I said earlier, just definitely encourage people to start that. If you notice someone is overdosing, the quicker we can get there to administer the Narcan, the quicker the effects of the drug opiate can be reversed and you can start that process. So it's just so important.
And Detective Boyd, you mentioned a new law, just protecting people that report. Is that something you could expand on a little bit? The reason I ask is I'd love to even get this out in a newsletter, something coming from the Wellness Corner, Jimena, from you potentially, where we can share with families and also students, because I think that fear of reporting or fear of calling is real. And I want to make sure that if a student is in that situation, they know the right thing to do is to call and get help for your friend and not worry about you're not going to get, charged criminally for this.
Yeah, absolutely. So we have, most people are familiar with penal codes, certain crimes, battery, all those are penal codes. We have health and safety codes, which are drugs, things of that nature. This particular section is a health and safety code. It's 11376.5, and there's a few different sections within 11376.5 that you can read if you Google it. But essentially what it says is anyone who seeks, it protects those individuals who seek medical assistance either for themselves or another person who's experiencing a drug-related overdose. And even in the event that either person is under the influence or even in possession of needles or even the drugs themselves, it protects them from any sort of criminal prosecution. And all of that is listed within that health and safety code section. For those who, would like to read it, it's all in there.
I might add that there are trainings available on bystander intervention, and that really leads to this, it kind of figures in this discussion, like what do you do as a friend? And I would add that it's important for opioids and overdoses, but it's also important for alcohol. You want to make sure that if you're with somebody that's had too much to drink and is passed out, that you don't walk away from them. and just leave them and hope that they'll wake up in the morning. So I would say that, perhaps looking into some bystander intervention. I know Sonoma State University is really big on bystander intervention trainings for all their students. And so it's something that could be really effective and goes along with what you're saying, Detective Boyd, about getting help for people.
Thank you. Dr. Cunningham and I both put in a resource from the Q&A as well called need.org, where you can also, that's another place to get Narcan. If anyone can travel to or lives by Berkeley, that's another resource. Somebody else mentioned that the SAFE team is also available to Cotati and to Rohnert Park residents as well, not just to Petaluma residents. Are there any peer-to-peer support groups or collectives where kids experiencing harm or a mental health struggle can be supported if they aren't willing or feeling safe reaching out to adults in their community?
Buckaloo programs would be a helpful resource for that. I can put that in the chat. They have a lot of peer programs.
We also have Mentor Me in Petaluma. They offer probably similar services as yours as well. They're really good, especially with the peer support part of it.
I would say too that there's a statewide program called Friday Night Live, which is a youth engagement, youth leadership, youth development program that really focuses on youth being involved in programs that don't involve substances. There are several, this is in your resource guide as well. There are several schools that are participating in that in Petaluma. We're really looking to expand the Friday Night Live program. And so it really does engage youth. It really helps them understand that not everybody is using and have a safe place to be in conversation with other youth. And so that information is also in your resource guide.
Anybody else has a question, feel free to type it in our Q&A so we can answer it for everyone to get the information. But at this time, it looks like we've answered all of our questions. Give a moment or two to see if there's anybody else who wants to add anything. But again, just want to say thank you to everybody that is here tonight, not just our attendees for coming and hearing this information and sharing it with our community, but all of our panelists, everybody that made tonight happen. We greatly appreciate everybody working together and bringing all of this really important information to our community. I don't see any more questions at this time. Does anybody else from the panel want to add anything?
I just wanted to add one more thing about the resource list, which I'm hoping will be really helpful because it covers a variety of topics and resources. One of the things that we also included in there, because when we think about how to have conversations with kids about substance use prevention, if you're like me, I remember it. And then when I go to have a conversation, I forget. There are some great guides for conversations at every developmental stage. And so if you have a second grader or a 12th grader, it gives really specific and helpful instructions. And so please check that out on the resource list as well if you have more interest in getting some support around those difficult conversations.
And I wanted to add that the county is working on more a series of additional presentations and workshops and trainings. And I wanted to say that we have two of them coming up in January, which are about vaping. And I know we're hearing a lot from the schools that vaping is a really big issue. We're working together with our tobacco prevention team, and we're going to be talking about vaping, tobacco, cannabis, THC, nicotine, all those things that we just think it's nicotine, but they're also vaping THC as well and other substances. We're going to have a session, one for parents and adults and school personnel, and another that's really focused on the middle school students. So we're going to be reaching back out to you to hope that the schools will maybe assign this particular training to their students so that they can get all this information. Sarah and her partner, Richard, who are from Panaptic, will also be conducting additional presentations throughout next year on, for parents, again, more about conversations, but also directed at youth and other professionals. So more to come on that, and we will certainly make sure that we keep Petaluma informed about all of those things.
Thank you. We got a couple more questions in the chat. While we have community members here, can anyone answer where or how students can access fentanyl test strips?
Face-to-face in Santa Rosa as fentanyl test strips, and I'll put that in the chat.
Thank you.
Next question. Hello, good evening. It has been a very interesting conversation. My question is, are schools giving these types of conversations to the students, and how often are they?
Hi. So we are working on developing a curriculum that will go K-12 for our school community. At this point, again, it's happening in the HI classes at the high school level, but it is a work in progress. So we don't have, I think it would be great if we could have some of our folks that are on the panel help out in our schools as well, but we do need a more coordinated effort in that area.
Right. Well, I don't see any more questions in our Q&A at this time, but there was the slide with all of our information if something comes up, and that will be, like we said, the recording will be shared. This presentation will be shared out. The information is there on that slide as well to contact many of us with questions and with all of that information that'll be coming up. But again, thank you to everybody for coming and hearing this information and being a part of this really important first step for our community. Thank you to everybody who came to put this together and put this on and made a group effort of bringing everybody here to get all of this information out. I don't know if anybody else wants to say a final note before we go.
I just want to thank everyone for being here, the panelists for being here, and for our participants. And if you're watching this on a video, thank you for watching it. And there will be more follow-up steps. We do need to do more around clearly looking at the curriculum that we teach here in the schools and making sure that's aligned, that all students are hearing the information, and as well as getting more and more resources out there. I know that one of the big issues, like we hear it over and over, right? The test strips, the Narcan, what is that going to look like? In our last meeting, it was talking with elected officials to bring some of that also to Petaluma, to our town, so that it's not just go to Santa Rosa face to face to get a test strip. There needs to be some more access here in South Sonoma County. But I just want to appreciate everybody's time and for being here. It means a lot.
Thank you, everyone. We will share this recording as soon as it and our Spanish one are available. Thank you so much. Have a great evening.
Thank you, everyone, for joining us. And I also wanted to say a lot of the answers regarding like school-based response were from Petaluma City Schools. If you do have questions for the school district that your children goes to, please do ask, and send whoever the principal or superintendent is at your school district emails or ask those questions. Thank you for joining us again. Thank you, everyone in the panel.